Hello, and welcome to another episode of Mental Wellness Insights, bringing sunlight into mental illness. Do you have a relative or a friend suffering from a chronic illness? Have you ever thought about the mental anguish they go through in their day-to-day life? Well, in this episode, Plutton Dutta from India narrates to us his life story. Please listen carefully. This is an eye-opener to most of us. Please remember to subscribe, like, hit on the notification bell, and offer your comments. God bless. Thank you for joining us.
Yeah, thanks for having me to share my story with you. Not much, talking in videos, but writing is my way of expressing.
Yeah. Can you kindly first introduce yourself to us?
Yeah, my name is Pluton,
Yeah.
and I'm from India.
Yeah.
I, I live in the eastern part of India,
Mm-hmm.
and I do full-time work. I am 40 plus, and I'm fighting with CKD for around 30 months now. So
it's 30 months.
30 months,
When
two
were
and a half
you
years.
when were you diagnosed?
I was diagnosed in December of 2020.
Yeah.
And so I was diagnosed with stage 5 kidney failure.
Uh-huh.
So from then on, I'm on dialysis. And so it changed things, it changed my life in a lot of different ways. Um, kind of, I was, in the beginning, it was so difficult to accept that something of this sort can happen to me.
Yeah.
Because I always thought that I was healthy, and I performed my duties from office going to managing family, everything. But, things were happening inside my body which I was not even aware of.
Yeah.
And so when we did the diagnosis, it came out that I had high blood pressure.
Yeah.
And this high blood pressure was the cause behind my the kidneys failing.
So all this time you had not known you had high blood pressure?
No, no. And I never even fell sick because
Oh.
of blood pressure because there were no symptoms. And even if there were, they were so minute that I didn't really focus much on them because it didn't stop me from, working, being active every day.
So
And, yeah.
eventually what led you to go for the diagnosis?
So the first symptoms that came out was I was gaining a lot of weight.
Oh, okay.
And then all of a sudden, one day I started having breathing problems.
Yeah.
There were like dizziness in the head. I had nausea. I was vomiting everything. I was vomiting more than I was eating.
Mm.
And then all of a sudden, there was a problem with my breathing. And it was so uh, difficult to breathe that I couldn't even take a step.
Mm.
Then so that was a wake up call. And then I consulted the physician, and I did a ECG, and I
Mm.
did some blood tests.
Yeah.
Till then, I had no clue about what a kidney failure looks like.
Mm-hmm.
I didn't know anything about it because, one of the things uh, that we are facing today is lack of awareness
Lack of
of our own
awareness. Yes. True.
health.
Yeah.
A lot of time we take our health for granted.
Mm-hmm.
We think that since we are not bedridden, we are fine. Nothing is happening inside. Everything is fine. The machine is all good.
Mm-hmm.
But something or other is actually happening and we have no clue. And that's why, blood pressure is called, high blood pressure is also called a silent killer
Yes. True. So
because it,
when you were eventually diagnosed, how did you take it? How did it
well,
affect your mental? Uh,
yes. So the day I still remember, I can never forget the day when I was in hospital in front of my doctor.
mm-hmm.
And the doctor gave me the bad news that your kidneys have failed.
Mm-hmm.
So you are going to be admitted in the hospital. The first thing was disbelief.
Mm-hmm.
I couldn't believe. I kept on asking him, can you recheck? Because I was so confident that it cannot happen to me.
Mm-hmm.
So
Yeah.
the first thing was disbelief.
True.
And then,
Many times we think we know it's happening to other people, but we do not think it can happen to us.
yes.
Yeah.
So, and then the situation was deteriorating every day. And I had no choice but to get admitted in the hospital.
Mm-hmm.
I was in intensive care unit for 15 days.
Mm-hmm.
I was literally fighting for my life. I was not even sure if I can make out alive out of this hospital.
Yeah.
And at that time, there were several surgeries that took place. They
Mm-hmm.
operated on my kidney, they created fistula, they created a lot of things. So it's a total process of, whenever you are diagnosed with kidney failure, the treatment is dialysis.
Mm-hmm.
So before dialysis can happen, a lot of surgeries needs to be done. So I was
Mm-hmm.
going through all of that. So I was hardly, in my senses.
Mm-hmm.
But within a week's time, when the sedatives and the medicines which make you numb, when they started wearing off, I started feeling the pain.
Yeah.
It was huge. It was hard to bear. Tears were rolling from my eyes all the time.
Mm-hmm.
The once, strong person which I used to think of myself
Yeah.
suddenly was actually in all tears. I was
Yeah.
broken.
And the tears was it just because of the physical pain or there was psychological pain too?
Actually, it's both.
It's both.
Because see, I am just 40 plus.
Yeah.
I haven't actually seen a lot of things in my life.
Mm-hmm.
And now all of a sudden my life is restricted.
Mm-hmm.
And all of a sudden I am leading a life where, I cannot do a lot of things at my wish.
Yeah.
So my freedom is gone. My lifestyle has to be changed.
Yeah.
I cannot go on long trips. I cannot do this. I cannot do that. So it was a challenging thing for me to accept.
Yeah.
Physical pain, is something that will eventually go, but mental pain is something that's very difficult to ward off.
Mental pain is
Because
very
if
difficult.
you,
Yes. And did you have any counseling, any therapy?
not in the beginning, not in the beginning, because in the beginning, my full focus was to get into a stable life because initially when things happened and I was hospitalized, I was totally unstable.
Yeah.
Unstable, I mean, so that I couldn't even eat properly. I was all in pain. I was all taking dozens of medicines, and my mind was sometimes numb.
Yeah.
So the first target for me was to become little steady, stable, walk
Yeah.
on my own feet.
Mm.
And then I thought that, I also had this belief that some miracle might happen
Yeah.
and someday I might be healed.
Sure.
But miracle doesn't happen to everyone, maybe.
It doesn't, but
And
probably your time of miracle has just not yet come. It
yeah,
will come.
perhaps. So, um, what happens when someone like me? Well, I can tell you my perspective that when I was diagnosed with this critical illness, and it's pretty serious illness. It's a pretty serious disease,
Yeah.
because two vital organs not working,
Yeah.
it takes a toll on your body.
Mm.
And so I started, changing my eating habits, my sleeping habits, my lifestyle. A lot
Mm.
of things were changed.
Mm.
But somewhere down the line, I also started having feelings of being overwhelmed, of feeling of, fear, of death,
Yeah.
of being, happening something really bad. Because, see, I do dialysis twice a week,
Yeah.
2 times a week.
Yeah.
And I meet a lot of patients there.
Yeah.
And some of the patients whom I knew who already had been friends are no more.
Yeah.
I have seen a lot of blood. I have seen a lot of suffering in my dialysis hospital.
Yeah. I saw that you talked about that yesterday.
And then, if you keep on seeing them every week,
Yeah.
you also feel that, this thing can happen to me.
True.
I'm no exception. So I would not say that I was always strong. I had my weak moments. I
Mm.
had my down moments. I had my moments when I felt really terrified. What's
Mm.
going to be next? Is there any future at all for me? I
Mm.
am married. So what's there for my wife?
Yeah.
What would she do? And then she is my primary caregiver.
Mm.
And I have seen the amount of anxiety she lives with at times when she sees that I am, having those bad days when I'm shivering with fever or rigor or, post dialysis side effects. Dialysis does bring a lot of side effects.
Yeah.
And when I'm actually shivering with pain, she is no doctor, but she wants to help me, but she doesn't know how to do it.
Yeah.
Nobody knows it.
Mm.
And then you know what? I have experienced that as you are affected with certain critical diseases, sometimes you lose friends.
Yes. 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 Many times you lose friends.
You lose friends because,
Instead of
who would like to be friends with a person who is a critically ill guy?
Yeah, but it's not a fault of any person to be ill, and nobody knows who will be
That
ill.
is so right. That is so right. Because, what we all look forward is support.
Yeah.
Support in the form of talking with us, somebody, if, because I have seen that a normal person doesn't feel really interesting to talk with a guy with a disease because we don't have anything exciting to offer. Our days are pretty uneventful. I go to hospital, I do my work, for my daily bread, I go to sleep, that's it. So it's been kind of a cycle for the last 2.5 years.
Mm.
And well, one other thing that I have found, and it's very common with chronic patients, that, you know, family support or things like that doesn't always come by easily.
True. Mm.
Because, when you are doing well, you are all successful, everything is going good for you, you have a very big family. But the moment you are going in a downward, situation, you start actually getting the very different worldview.
Yeah.
So now regarding mental health, why it's so important now? Because I have found writing a way of finding a little relief. Because patients like me have a lot of things to say.
Yeah.
We really want to talk about our pain. We really want to talk about the bad things happening in our body to somebody. But who has the time and the patience to listen? Hardly somehow, hardly anybody, because everyone is busy with their own lives. Then who should we talk with? Who should we tell to? And the medical system, the doctors are always in a rush. They're always in a hurry. They have no minute. They'll have no time. They'll come for a minute. Oh, how are you? And they will write a page of medicines, and that's it. What about the rest of the 24 hours? Whom do we talk with?
True. So yesterday you said you were feeling down. You say you were overwhelmed. It was dark, perhaps of meeting a miserable end. What was your mindset at that point in time?
Yesterday something happened. I mean, yesterday I had dialysis in the morning.
Yeah.
I came back home. I ate. I did a couple of things of office work, and then I was trying to rest.
Mm-hmm.
I was watching something in the movie, maybe something really related to hospitalization patients and things like that. And suddenly it came into my mind. I don't know how and when and how did it all happen. I was not thinking anything really.
Mm-hmm.
That what happens if I'm no longer there tomorrow? Well, I do understand that nobody is guaranteed a tomorrow,
Nobody.
but we we feel more because when the pain strikes in, the physical pain, it cannot happen that you are in a physical pain and you are in the happier mind.
Sure.
It will be impacted,
Yeah.
and that's, I think, is the mind body connection. If I hurt you physically,
Mm-hmm.
somewhere down the line your mind is also going to be hurt.
Mm-hmm.
And this episode, these things like, feeling bad all of a sudden, it's not something that is very uncommon. It's pretty much there. It's just that I think of speaking it out. I know a lot of patients who would be silent and not say a thing.
So a lot of people are going through this, but they do not have an avenue to vent it out.
Yeah, yeah. And social media is for me. It's a kind of a blessing because I am able to connect with so many people.
Yeah.
And then, yeah, see, whenever I write, my focus is not on getting, um, likes or people saying very good things. I know people care, but my main motive is to spread awareness.
Yeah,
Through
exactly.
my writings, I tell people that take care of your health, go for those checkups.
Yeah.
Don't miss out on them
Mm-hmm.
because you never know what's happening inside. And don't get into a situation like I am in because the whole life will change.
Mm-hmm. You said something very touching that we deal with life's challenges with a broken body.
Yeah. Because see, because I am ill, because I'm sick, it doesn't take away all my duties, right? I
Yeah.
still have to perform them. I still have to work full time to earn my daily bread. I still have to do the family chores. Still have to take care of my wife.
Yeah.
But all of this challenge, and life is a challenge. There is suffering, in every aspect, but we are doing it with a body which is not even participating with us.
Mm.
And the medications are like we are popping around a dozen pills every day. Every medicine has a side effect, and the side effects can hit the way you are thinking, the way you are feeling, because these chemicals go into your brain. And yes, I have my feelings. At times I feel fine, at times I feel very, very low, but I hardly have people to talk about. Well, I would, only person who is always with me in this most difficult time is my wife.
It's your wife. Yeah.
But she is also having a difficult time because she didn't ask for anything of this.
Yeah.
And
And
she is also about my age. And
and
she
this,
has also got a lot of world to see.
yeah, this brings out the need for caregivers to also get therapy, isn't it?
Absolutely, absolutely. Because the caregivers, they are actually helping us to survive.
And
Without her, I wouldn't have survived.
it takes a toll on them too.
Oh well, I feel to say it that there is a lot of dependence on her right now. Even when I was diagnosed,
Mm.
but I can't help it because there would be days when I would be so low that I can't even take my own medicine. A dialysis, if we do a research, thorough research, a dialysis, once we are into dialysis, it creates dozens of side effects.
Yeah.
And they are all very, very painful. And they
Mm.
can be very tricky because you know what? The biggest challenge for us is dialysis is not something like a common disease. It's not like fever, cold, or some headache or stomach pain. It's very difficult for a patient to actually make the other person understand what we are going through.
Yeah.
And for the other person, like let's say for my wife, even she wants to help me, it's so difficult for her to even understand what I am trying to convey because she hasn't experienced this paralysis ever.
Yeah.
How would she know? And not everything can be found in Google.
No, not everything.
Yeah. So this is my, through my personal experience.
Mm.
I do a lot of reading these days, which I have picked up.
Yeah.
And truth be spoken, I used to love sports,
Yeah.
but sports is something I cannot actually go into those heavy sports anymore because of this. My doctors have strictly instructed against sports or heavy exercises.
So again, you feel bad that you are not able to do what you loved to do.
No, yes, I do feel bad about that.
Yeah.
I feel bad that I cannot go for a month-long vacation anywhere because if anywhere because I have to do dialysis after every 3 days.
Yeah.
I cannot eat whatever food I would like to.
Did you think about a transplant?
Transplant, yes, I mean that's something which has been a lot of people have asked me about it. But transplant is something that requires your body to be fit for surgery
Yeah.
because transplant is a major operation.
Sure.
And right now, my blood tests or the results show that I'm not yet ready for surgery because I'm anemic right now, as in low hemoglobin, which
Mm.
has been because of side effect of dialysis. And once you are anemic, you can not do a surgery.
Yeah.
So I am left with the only option as of now with is of dialysis.
Yeah.
I I only pray. I only wish if, because see, this is 2023, we are in advanced civilization.
Sure.
I only hope that sometimes some medicine, some cure, some better treatment comes up for us, for kidney
Yeah.
patients.
We pray that it
Because,
one time will happen.
because this painful dialysis in the long term ruins anybody. It
Sure.
ruins the body. It affects the other organs. And
You mentioned that the nature of chronic illness is that it's a marathon and not 100-meter sprint. It changes life. What did you mean?
I meant that, I know that I am not going to be cured in a few months or maybe in the next few years or maybe cured at all. So I have to run this long race till the time I am alive. I have to bear the pain till the time I'm alive.
Yeah.
There's no cure.
And you said that you have met a lot of patients in that state, and some of them give in to depression.
And some of them,
Give in to depression.
yeah, I, I went into depression, after 1 or 1.5 years of, this diagnosis, because this long-term dialysis started destroying my body. I lost almost 34 kilograms in a matter of 6 months. And then all of a sudden there was something, I started having heart problems. Heart problems. I did all those heart treatments as well. So it happened that, I started feeling bad about myself. I started feeling guilty. Guilty of, maybe I thought that maybe I could have prevented this. If only I could have been more aware of my own body. If only I had more awareness of medical science and the way the body works. I felt guilty, but I know that I never wanted this. I never caused this myself knowingly.
Nobody would
It
want to
happened.
do that.
It happened. And
Yeah.
as you know, in times of weakness, people think of a lot of things which are dark.
Sure.
One day I was thinking that maybe God punished me.
Oh, God. Yeah.
I felt it so strongly that, I must have done something very wrong. That's why I got this punishment.
Oh, God.
And that made me so bad. That made me feel so bad. I was crying that day. And I felt that, why I am thinking even like that? Yeah, I felt like God punished me. But, on the next day, I only felt that no, that was not the right thing to feel.
Yeah.
Why would God punish me? What have I done?
What have you
I
done?
haven't done anything wrong to anybody.
Sure.
So why would he punish me? So I then thought that maybe it was actually thinkings of a weakened mind.
Yeah.
Maybe I was weak. Maybe my body gave up. That's why my mind was weak. And that moment of time, that dark feeling came into my head.
Yes.
But the next day it was gone.
Yeah.
But you know what?
Yeah.
There are days I feel so hopeless because I don't see, because our disease is unpredictable.
Yeah.
We have no timeline. We don't even know whether we are going to be cured or not. Living with such an unpredictable life, it's so difficult.
So we have a few minutes left for this conversation. Within these few minutes, I would request that you tell the world how a patient like you would like to be viewed, to be helped psychologically, because you are able to talk. What about one who is not able to talk?
And that's a very, very important question, because I know a lot of patients personally who would not speak a word about their pain. But I know what kind of pain they are in. I happen to have a little patience, and I listen to them. And 5 minutes of talking with them, they will start breaking up. I have seen even the stronger ones crying in front of me because of this pain and the hopelessness and the unpredictable nature of the disease. I would suggest to anybody who is going through such chronic illness, be it cancer, be it, kidney failure or anything which is long term, if you are really feeling bad over a longer period of time, it's better to take professional help, because those are the people who can talk you out of it.
Yeah.
Because I think one of the biggest help that patients like us can get is to get someone who would listen to us.
Yeah.
Who would have a patience to listen to our boring, sad stories. Because nobody likes to listen to boring, sad stories, but that's all we are filled up with. I cannot talk about my achievements while I'm being on treatment for last 2.5 years. I cannot talk about exciting stuff because that's not actually what I'm thinking of. I am being real. Someone, and the professionals are trained in that way that, they can actually listen to your rants for hours.
Yeah.
So take a professional help. And if you are lucky enough to have a family member who is willing to give you that listening ear, then all the better.
Yeah, so to family members and to friends, it's very important to give somebody a listening ear.
Yeah. And I can tell you this from my experience of talking with a lot of patients, not every family member are supportive.
I want to thank you so much for this time. This is just the beginning. We will be speaking because you have a lot to tell. You have a lot that will help so many people going through difficult situations. You have a lot also to help the caregivers and also the medical profession. They can get something from you. So I want to thank you so much for being here today, and we are going to speak more.
And I want to thank you for, having me in your discussion. You found me that I can be of help to somebody. Yeah. So if my sharing of my story even helps in a single person, I am thankful.
Thank you so much. We will get back to you to give us more stories.
Thank you.
May you be blessed.
Thanks a lot.
Thank you. 3 quotes from Plutton Dutta. The nature of chronic illness is that it's marathon and not a 100-meter sprint. It changes life. The truth is, death is smiling at us all, and all we can do is smile back. We deal with life's challenges with a broken body. Please meditate upon those quotes and offer your comments on the comments section. Remember to subscribe, like, and click on the notification bell. Blessings.